This is Sarah Finkelstein, and welcome to the Sarah Finkelstein Show, where the next 10 minutes can change your life. Our topic today is regarding Medicare, and there are 10,000 to 11,000 people turning 65 every single day around the country. What is so significant about that age, 65? It's significant because that is when you qualify to go on Medicare. And Medicare, as you probably know, is the federal health insurance plan for people that are 65 and older. But also, Medicare covers individuals that are younger than 65 who may be on Social Security disability. If you know somebody who is on Social Security disability and they are younger than age 65, please share with them that after 24 months of being on Social Security disability, they qualify for Medicare, even though they may not yet be age 65. So let's focus in on penalties that Medicare might impose on you. I meet a lot of people, a lot of baby boomers, who tend to tell me how overwhelming Medicare is, how it can be very confusing. And a lot of people, believe it or not, are surprised that it is not free. That's correct. Medicare is not free. There are costs attached to Medicare. But for today, what I want to focus on is potential penalties that you or your loved ones may be subject to and that you may not be aware of. So let's talk about the various parts of Medicare that can be subjected to a penalty. So Part A is the hospital portion of Medicare. And for most people, they do not pay a premium for Medicare Part A. Why? Because they pay into the system through payroll deductions. So for example, if you or your spouse has worked at least 10 years, you do not pay a premium for Medicare Part A. But what if you or your spouse has not worked a full 10 years? What if you've worked less than 10 years? Then you have to buy Part A by paying a monthly premium for it. And that premium could be anywhere from, let me take a look at my notes here. It could be about $224 to $500, depending upon how long you did work. Now, what if you have to pay for Part A? Let's say you're one of those people that is not eligible for Part A as premium free, and you don't sign up for it when you are eligible for it. Guess what? You will get a penalty. And what is that penalty? Well, that penalty is 10% for each year that you could have had Part A but did not purchase it. So for example, let's say that 2 years passes, you could have had Part A and you didn't. The penalty is 10% for each year, and you pay it for 2 times the amount of years that you could have had it and did not have it. So for example, if you could have had it for 2 years, your penalty will be for 4 years. But at least after that 4-year period, you're no longer subject to that 10% penalty. Now, what about Medicare Part B as in boy? That is pretty much everything that happens outside of the hospital. For example, your doctor visits, your outpatient procedures, your lab work, your diagnostic test, the ambulance, outpatient procedures, a whole bunch of stuff cancer screenings and chemotherapy, diabetic screenings and supplies. It all falls under Medicare Part B and a whole bunch of preventive services. Now, everybody has to pay a premium for Medicare Part B. And for most people today is $170.10 per month. Now, let's say you're retired at age 60 and you went without any health coverage because you were very, very healthy. And at 65, you did not sign up for Medicare. Well, there is a penalty for Part B, and that is 10% for each year, each full 12-month period that you could have had it and did not have it. And that penalty stays with you for the rest of your life, ongoing forever. Now, what about Medicare Part D? I always say it's easy to remember D for drugs. It's your prescription plan. And if you're on a Medicare Advantage plan, most likely your prescription plan is embedded in your Medicare Advantage plan. But there is a late enrollment penalty for Part D. So let's say that you turned 65 and you went with original Medicare and you did not get a drug plan because you don't take any drugs. You're very healthy and good for you. Knock on wood, that's great. But the fact that you could have had the drug plan and you didn't get it, as long as you let 63 days pass by without having drug coverage, you will get penalized. Now, what is that penalty? That penalty is 1% of the national base, which in 2022 is $33.37. So 1% of that for each month that you could have had the drug plan and did not. And that penalty stays with you forever. It's added to your Part D premium. Now remember that national base amount, which as I said is $33.37 in 2022, can certainly go up next year. So that base amount will continue to increase, and your penalty, your 1% penalty will increase when the base amount increases as well. So these are important facts that you must be aware of. And unfortunately, nobody calls you, nobody from the government calls you and tells you these tips so that you can protect yourself. And that is why you should be working with an independent agent who can help you understand the ins and outs of Medicare and how to avoid potential penalties that Medicare might impose on you. You have to also be aware about Cobra. If you are on Cobra because you've left your job and they've allowed you to continue your health insurance, and you're paying, of course, a premium, and typically Cobra premiums are much higher than what your payroll deductions were at work for your health insurance. But remember that once you turn 65, that Cobra is not considered creditable coverage in the eyes of Medicare. So if you stay on your Cobra plan beyond age 65, you will get penalized for not having creditable coverage in your drug plan. So make sure that if you happen to be over 65 and you happen to be on Cobra, check with your Human Services Department to find out whether or not the plan is considered creditable coverage. So be forewarned, get your ducks in a row, know what you need to know. And if you have any questions, feel free to reach out. You can also go to my website that is specific to Medicare only, which is www.yourmedicarelady.com. yourmedicarelady.com, and feel free to share that website with your friends and neighbors who are in the same boat, also coming up to age 65. And if you'd like to learn tips as to how to save on your Medicare costs, give me a jingle. This is Sarah Finkelstein. Search for our other segments on the Sarah Finkelstein Show. And the easiest place to find previous segments, just go to the sarahfinkelsteinshow.locals.com.